Well, thank you everybody for joining us today. I'm sure we'll have some others joining as we presentation. I wanted to welcome Kimberlee Vandervoorn to our webinar series that we've been having. She's here to present some information from UnitedHealth Group. And we ask that you keep your phones muted and use the chat feature if you have any questions. I'll be monitoring that during the presentation, and we will make sure to cover them at the end. And with that, I will pass this over to you, Kimberlee.
Thank you, Hope. Thank you so much, and good morning, everyone. Just wanted to let everyone know I am having a few technical difficulties working from home, and you might hear a stray dog bark, but hopefully not too much. I think it's one of those things we're all dealing with these days. I'm happy, very, very happy to be here with my friends at the Pennsylvania Restaurant and Lodging Association. So wanted to share with you some of the things we've been working on to help the industry through the devastating time, the crisis time of COVID-19. And then as the industry is starting to pivot towards safely reopening, wanted to just offer up some of the things we've been working on to help hotels and restaurateurs do that, safely reopen with a healthy team. So that's what today is about. And next slide, please. So I'm going to go through a variety of resources that are available to you now as an employer that can really help you and your employees not only get through the remainder of COVID-19, but safely reopen. Now, you probably are aware that we have a partnership, very lengthy partnership with UnitedHealth Care, which offers discounted solutions, medical benefits, et cetera, to PRLA members. But I want to just start off by saying that none of this that I'm going to talk about today has anything whatsoever to do with UnitedHealth Care. So you do not need one does not need medical benefits. There are no minimum hours worked required. There's no participation. So think about all of these things we're going to talk about today as completely mutually exclusive from medical benefits. They're still available, but these things we wanted to offer you solutions that don't require purchasing medical benefits. So with that, we're going to talk about at-home lab testing. We're going to talk about telehealth, which is all the rage now and in the future. We are going to talk about digital physical therapy support and mental health, substance use disorder, and suicide prevention. Next slide, please. These new on-demand offerings that we're going to talk about they're so great because they're meeting people where they are. People now want to get the care they want, the care they need, when they need it, how they want it. Personalized, digital, convenient, deeply discounted for members, safe from their own homes, away from crowds. That's what this is. This is all on-demand, digitalized, easy access, giving people what they want. And so the first thing we're going to talk about is Teladoc. You've probably all heard of the brand Teladoc. Teladoc is the global leader in telehealth and virtual care. And so when we approached the Teladoc leaders to partner with us, we were just absolutely thrilled that they were willing to do that for the hospitality industry, for members of our association partners like PRLA. So we selected Teladoc, the global leader in virtual care. They are a publicly traded organization. They hold themselves to the highest standards of transparency, accountability. They serve millions upon millions of people across the country, across the world, I should say. They deliver over 450 medical subspecialties, 175 countries, 50 languages. Their scale is just simply unmatched. So that's why we were really confident in Teledoc's ability to deliver and serve the hospitality industry more than any other virtual care delivery provider. So we worked with Teladoc Health. We decided to partner. And if you go to the next slide, please. This gives you a whole variety of different conditions, just common conditions that can be virtually treated, really just about anything that doesn't require emergency care. And if you've never had a virtual visit, I would highly recommend you try it. I had my first virtual visit about 2 years ago, and it honestly changed my life. It is just absolutely amazing how we can just go online, have a face-to-face, FaceTime visit with a practitioner, be diagnosed, and have medicine prescribed, staying out of crowds, not having to go to our doctor's office, staying out of away from the sick people in urgent care, on and on. It's just, it's fabulous. I will never go back. And there are just a plethora of conditions that are treated virtually. Next slide, please. So now, during COVID-19, of course, the Teladoc is adhering to the CDC guidance in making sure that people provide self-assessment when they log on. So they will be asked a variety of questions, and then based on the information that's presented, the Teladoc experts will come back with certain recommendations, whether it be call your doctor, shelter at home, or whatever might be appropriate based on that person's self-assessment with regard to COVID-19. Teladoc Health has actually been the only virtual carrier that's been working closely with the World Health Organization, CDC, the U.S. Centers for Disease Control and Prevention. They've been sharing real-time insights with those in the government that are leading the responses. And so they are really a partner in getting us through this crisis in so many ways. So this slide, I love this slide because this really shows how really the amazing show of support that Teladoc Health has committed to the hospitality industry. This is just amazing. So what they've agreed to for members of our association partners is this bundle that includes general medical, behavioral health, which is mental health, dermatology, back care, expert opinions, second opinions, and all of it is priced. So employers can sign up employees for this. It is $7 a month per employee and includes that employee's family, children, spouse, etc., for $7 a month. No co-payments, $7 a month is all it is. And that person and that person's family can have, that the children can have strep throat 5 times in 2 weeks. I hope not, but and an ear infection and whatever. And if somebody's battling mental health issues, which so many people are, they can meet with a mental health professional once a day, once a week, once a month, or 3 times a week. And it's still $7 per employee per month. It's truly a gift to the hospitality industry. I am so humbled that they were willing to do this with me. So that is the bundle that's available now. If you go to the next slide, please. And again, this has nothing to do with health insurance. This is, think of this solution for all of your employees that are furloughed now, who you're expecting to bring back when you reopen, your part-timers, your full-timers, those that have no insurance. It matters not. The number of hours matter not. Insurance is irrelevant to this. This is for everyone, to help everyone. So some of the common questions I hear, how many people need to be enrolled? 2 people need to be enrolled in this plan to make it a group plan for us to get this amazing pricing. Again, every employee may access this. Again, includes all family members. The way it works is that an employer simply goes to the link that should be in this presentation somewhere, goes to the link and sets up his or her employees. And it's as easy as, if you've got a small organization, you can simply manually input the employee data in the portal, whether it's 2 people or 30 people. If you have a larger employee, number of employees that you wanted to enroll, you can give them an electronic feed. You can get the names to Teladoc in many, many different ways. Once you do that, you're within 24 hours, your employees are signed up and able to use the service. The way it works is that the employer will be charged for the number of employees on the service that month, each month. Again, $7 per month per employee. And if employers somehow wish to cost share with employees, they're certainly welcome to do that in whatever way they deem appropriate. But for the purpose of, the only way I could get this low price is by simplifying this operationally. And so there can really only be one check, one payment, one bill going to the employer, and then the employer remits the payment monthly. Now, the employer may change the number of people on the plan really monthly. If people fall out of the team, leave the organization, you can take people off, you can put people on. It's as easy as anything. When you do sign up, they ask you to sign a contract, but the contract can be nullified anytime with 30 days of notice. So it's really, you're not locked into anything more than a month at any given time. So this is really an incredible a gift and offering to the hospitality industry, something that so many people in the industry who of course don't have medical benefits, and they don't have anything. They don't have any health and wellness resources at all. This is an incredible way to enable them to have care, to get care on their own time, when they need it, how they need it, without needing to leave their homes. Okay, the next offering is called Let's Get Checked. And we partnered with this is an at-home lab testing company. I bring it before you now for a couple different reasons. Number one, because I have reserved a number of COVID-19 and antibody tests for our hospitality association members to purchase for their employees. That is going to be available any day now. FDA is going to approve the COVID-19 at-home COVID-19 tests. The tests that are out there now, you need a medical professional to perform, administer. The at-home tests are the ones that will be approved any moment now by the FDA. These are the tests that all the large carriers are going to be using. All of UnitedHealth is going to be using these at-home tests. Well, I've been able to reserve some for hospitality. So those will be coming. Those will be approximately $129, something like that. Coming very soon. There are a lot of very, very, very large hospitality employers that are getting their orders in now on the COVID-19 test. I keep hearing two different things, either that people are employers are very, very interested in the antibody test, or they're very, very interested in the COVID-19 test. We'll see what happens when they're available, but suffice it to say, I will have both of these types of tests available to you, and I will let PRLA know as soon as they're available, and there will be an order form for you to use. The other reason I wanted to let you know about Let's Get Checked is clearly employees don't have any money right now. They're not working, et cetera. But what I want to let you know is that we've negotiated this deal with this at-home lab testing organization that's given us 25% off retail for any testing that your employees may need. Now, this is simply a pass-through to your employees. You don't pay anything aside from, let me make this clear, for the COVID tests, the employer has to buy them. But for these other tests that we're talking about, everything from lipid panel to A1C to sexual health to thyroid to colon, cholesterol, all these other things that we all need to get all the time, that's just simply a pass-through to your employees. You give them a link. If they'd like to buy a test at 25% off, they may do so. They pay at the point of service. Test goes to their house. They take the test, send it back, and their results are online 5 days later. I tried this myself. Very easy. Prick your finger, put the blood on the paper, send it back. It's as easy as anything. So the reason I'm making this available to you now is not with the assumption that your employees have money to spare, because I'm acutely aware of the devastation right now in the industry. But if somebody needs something, if somebody needs a test, because life goes on and people get sick and need testing, please let them know about this. It'll keep them out of labs that have germs, out of a doctor's office. They don't have to go to a doctor and get an order, then go to a lab and get the blood drawn, and then wait. They can do this all from the comfort and safety of their homes at a discount. So please pass this along in case any of your employees are in that situation. And again, there will be a lot more information to come in the coming days about COVID-19 and the antibody test. Next slide, please. This slide just shows you sort of the how it all works. What happens when the person calls or orders online? What is the review process? What is the delivery process? What is the follow-up process, et cetera? And this is just a variety of information about kind of the benefits of this particular company and what people have access to in terms of data, the FDA approval process, et cetera. Okay, this is another, Kaya is another one of my partners who's a really wonderful partner. It's a best-in-class digital, virtual, physical therapy program. It's amazing. I'm working on partnering with them on a larger scale when COVID-19 is over, because I think it can really help the hospitality industry. Kaya specializes in musculoskeletal disorders, which are clearly run rampant in the hospitality industry with hotels and restaurants. So what my friends at Kaya have done to help with COVID is they've offered 1,000 free licenses to Kaya's back pain virtual physical therapy program until July, and they'll probably agree to extend that for me as well. So if you have anyone, if you yourself are suffering from back or neck, anything in the musculoskeletal line, or your employees, you're trying to get them back to work, trying to get them healthy, just pass this link along to them. They can sign up. It's absolutely free. It's state-of-the-art physical therapy. Nobody can go to physical therapists now. People still need physical therapy help. This is free. This is best in class. So please just share this with them. You can look at a YouTube video on what it's all about. It's a really neat program, and they've been gracious enough to make it free for us for a time. Next slide, please. This is a little bit more about the Kaya's approach. It's a holistic approach. It includes exercise, education, kind of holistic, overall holistic mind, body, etc. And next slide, please. Optum Perks is a free prescription drug savings card. And this is, we've had a similar card out for a couple of years now, and this is just it's new and improved. And it's got a much better website. It's got a much farther reach. It's a free prescription card. It's going to get you and your employees about 80% off on most prescription drugs, most FDA approved prescription drugs nationwide. The only pharmacy that I've ever encountered that does not take this card is Kaiser, which is predominantly located in the Mid-Atlantic and in California. But every other pharmacy, whether it's Walmart or Costco or CVS or Walgreens or your local grocery store, they all take this. And it's just a really easy way to help your employees save money. The website has all been reskinned, so it's a nice user-friendly website, and it will allow you to search by medication, allow you to search the closest pharmacies by medication to find the best deal. And it's really, if you do this, you'll really be horrified or surprised at how different the prices are right up the street. One place right up the street could charge $10 more for a low-cost prescription than someone else up the street the other way. So it's good information, and if you go online, you can either just download an image of the card and use that, or you can click on get a coupon specifically for that drug at that time, take it to the pharmacy, you get your discount. Absolutely free, costs no one anything. Okay, next slide, please. Okay, so I wanted to talk for a few minutes about mental health, substance use disorder, and suicide prevention. So my friends in the hospitality industry, my association partners and industry leaders and folks all over the place have been talking with me for a few years about the escalating mental health crisis in the hospitality industry, escalating mental health, escalating substance use disorder, escalating suicide, all a vicious circle. And so I made it my 2020 priority to dig into this issue and to develop and find solutions and put together something comprehensive for the hospitality industry. As soon as I started this, of course, we were hit by COVID-19, which is has created such a crisis within a crisis, and now the mental health crisis is so much more acute with the devastation, the anguish, the hopelessness. It's a obviously really scary time for people. So the things you see in front of you, I've been working with a lot of different, just wonderful partners out there who have made their resources free to us for hospitality. And there'll be more to come on these, but I just encourage you to go on these resources, share them with your teams. My team has been using a couple of these, and they have been really lifesavers for us during this incredibly stressful time. I'll just run through a few of these. So Active Minds is it's an organization, it's a nonprofit that focuses on suicide prevention, mental health, education, etc. Any of you that have been in on our focus groups, first of all, I thank you. Second of all, we're at the next phase where we have a survey out to all restaurant and hotel employees. We've got hundreds of responses, and we're hoping to get more to inform our efforts. If you would like a copy of the study and you don't have it, just let me know. My email address is at the back there, and I'd be happy to send it to you. So we've partnered with Active Minds. We've underwritten a hospitality-specific research and design initiative the only one that's ever been done of its kind, to really dig into what are the things about hospitality that are contributing to this, to the mental health, substance use disorder, suicide prevention, and what is the data, and then once we collect the data, then we develop a suite of solutions, a suite of resources that will be entirely free for every single association, hospitality employer and employee in the U.S. So very, very, very excited about that. If anyone would like to help with that, please just shoot me an email. We would love to have as many people involved as possible. Sandvelo, we love Sandvelo. If you haven't tried it, please try it. This is something my team has been using for a couple of months now. It's an app. It's the #1 rated app for stress, anxiety, depression. It's clinically proven. It's evidence-based that using Sandvelo every day makes people better. They use it's all designed by clinical psychiatrists, psychologists. They use cognitive behavioral therapy precepts to do everything they do. The Sandvelo owners have been gracious enough to stand up a special hospitality landing page and community for us, which is absolutely fantastic. This is really a phenomenal tool that helps people through every day. And again, we're delighted that we'll be able to welcome hospitality people to a page that is for them. Patients Like Me is a new partner as well. They've also offered to stand up a page for hospitality, a whole community for hospitality. And so where Sandvelo is more of a independent kind of guiding you through every day with learning modules, meditation, daily tips, things like that, kind of tracking yourself, tracking your progress. Patients Like Me is a more of a health network that helps people, similarly situated people, find new treatments, connect with other people, peer-to-peer, improve their outcomes. So it's really for anyone, whether you have COVID-19, whether you have heart disease or diabetes, or a bloated disc in your back, or whether you have a mental illness. Regardless of what you have, there's a community there for everyone, and it makes people feel, it's a wonderful place for people to feel connected with similar people. Again, they have set up a page for us just for hospitality, and on those pages will be linked a variety of different resources that are really, really pretty critical. So your employees will go to these spots, feel welcome. That's the idea. Feel welcome. The materials will be updated, and then they will be able to go to their toolbar and say, oh my gosh, if I'm feeling like this today, let me click on this. Ben's Friends, probably a lot of you have heard of Ben's Friends. It's just a phenomenal kind of NAAA kind of for hospitality, for people in hospitality, by people in hospitality, and it's all over the country, and also telephonic. So great, great people. Next slide, please. Psych Hub is, I just discovered Psych Hub. It's truly amazing, and it's this incredible comprehensive learning platform on mental health, suicide prevention, substance use. How do you talk about it? It's just a really neat, really neat free platform. Shatterproof is a national nonprofit dedicated to reversing addiction. I am partnering with them, and we are going to have some new offerings in May. Again, all of this will be free to you and to your employees. And then finally, just a whole bunch of resources here. Crisis text line, substance use disorder helpline, all free. Emotional support helpline for people and their families. And then again, just wanted to remind you, all of this is free. The only thing we couldn't get to be free but close was the teledoc, the telemedicine, which is a tremendous mental health, not only medical, but mental health, giving the gift of mental health to your employees. As many unlimited visits, no co-pays, $7 a month per employee and that employee's entire family. That is the suite of mental health, substance abuse, and suicide prevention resources we have now. We continue to be working on this because it is a top priority for us to help the industry with this crisis. So you'll be seeing a lot more from us from that standpoint, but all of those resources are available now. Questions?
Yes, if anybody has any questions, please use the chat feature. Or with the amount of people, if you wanted to unmute yourself and ask a question. I had a question, Kimberlee. How long are these programs going to be available for free or at the $7 rate?
That's forever. That's just, the teledoc will go on forever.
That's wonderful.
The only other thing that is, San Velo is making their premium resources available just to hospitality through 2020. But I'll be in discussion with them well before that to create a different offering. So consider everything to be free except teledoc.
Okay, great. Did anybody have any questions or any comments they wanted to share? Well, if not, we have this recorded. You have Kimberlee's email right here and Amy's email, and we're always available if you have questions about these programs. We will be sharing this webinar, recorded webinar with you via email, and it will be up on our website. I want to thank everybody for joining us today. And Kimberlee, thank you so much for presenting these wonderful programs that are available for our industry.
Thank you, Hope, and thank you to everyone. Please do not hesitate to reach out to Amy or me. That's what we're here for. So if you have any questions whatsoever, just shoot us an email, give us a call. We are very happy to help you talk through any of these solutions, and we wish you health and safety, and particularly as you look to reopen.
Wonderful. Thank you, Kimberlee. I hope everybody has a wonderful rest of the week, and thank you again for joining us today.
Thank you, Hope. Take care.
Thanks. You too. Bye-bye.